Good afternoon, everyone. Thank you so much for joining our webinar. My name is Lydia Amoretti Morgado, and I'm the Communications Manager at Jackson Health System. You are joining Conversations in Care. This is a program created by the Jackson Health Foundation. And today we have a very important topic. We're going to focus on sports medicine and injury prevention. I have the pleasure to be joined by Dr. Jose Inzunza. He is part of the Jackson Medical Group at Jackson Health System, and he specializes in orthopedic surgery, sports medicine. Thank you so much for joining us. It's a pleasure to have you here. As you know, we were getting ready for summer. This is a time with a lot of us. I have more free time in terms of if you have children, you don't have to worry about school, homework, tests. So you have more free time to do sports and activities outdoors with your kids, or just in general. You know, we have kids that are going away to college. A lot of them are athletes. So this is a very important topic that touches everyone in the family. So thank you again so much for being part of this webinar. We wanted to start off about how can we determine whether we are at risk of having or suffering an injury while doing sports.
Well, thank you very much for having me. It's a pleasure to be here. So in terms of assessing risk factors for having injuries, there's a handful of things that you can look at ahead of time to gauge that. Some of them have to do with whether you're using appropriate equipment. For example, if you're a distance runner and you're using worn out running shoes, sometimes that can cause injuries down the road. Or certain sports and activities require certain safety equipment, like for example, helmets, and they're there for a reason to prevent certain types of injuries. So those are a couple of important ways to mitigate risk. A good warning that your body gives you that maybe an injury is coming, particularly an overuse injury, is when you start having pain doing an activity where you didn't have it before. And so playing through pain is usually not advised because it can cause a bigger problem. And then also for those who recently had an injury and they're kind of on the way back, if you return from an injury too soon, sometimes you're at a high risk of re-exacerbating the injury or injuring something else because the muscles just haven't gotten back to their normal performance yet.
So I guess the key is to listen to your body.
100%, yes. That, I mean, in pretty much every walk of life, just listening to your body is a good place to start.
Absolutely. And what are some of the exercises that we can do to prevent a ligament tear?
Ligaments are a connective tissue in the body that connects one bone to another bone. And their function is to be a sort of the last line of defense in terms of stabilizing a joint. They're static structures. They don't really change shape on purpose, whereas the muscles and the tendons that go around a joint, those are more dynamic structures. And so by keeping your muscles and your tendons healthy, those will control the movements of a joint so that the ligaments don't need to kick in and provide that last restraint.
Oh, that's great information.
So there really isn't, I mean, every joint has certain exercises that can strengthen the key muscles and tendons involved, but just as a general concept, you want to have good overall muscle conditioning. If there's a certain joint where you are having issues with sprains.
So I guess the key is slow and steady.
Yes.
Build up to your higher performance, but don't start fast from the beginning to prevent tears.
Exactly.
What are some of the things that we can do to avoid sprains and strains?
So sprains and strains, even though they sound
Similar.
very, very alike, that they actually refer to injuries in different tissues. Sprains are an injury to a ligament, and strains refer to an analogous injury in a muscle or tendon. But the concepts are all pretty similar. By just having good overall fitness and well-conditioned muscles and avoiding overuse, budgeting in time for good rest and recovery, these are all things that reduce your risk of injuries of all of those important musculoskeletal structures.
Which leads me to a very important question that we talked about off camera before we started. How do we warm up and cool down properly? Because I know that that's where we fail, and that's where a lot of the injuries happen.
So oddly enough, the topic of warming up and to a lesser extent cooling down actually stirs up a little bit of controversy in medical research because it's something that people try to measure what the effect is. Does it reduce the incidence of injury, or what effect does it really have? And there's a lot of conflicting evidence out there. The thing we do know is that it doesn't cause harm. There are some studies that suggest that it actually doesn't, warming up doesn't do much to prevent injury, but it does improve peak performance because it gets muscles ready to do the dynamic movements that they need to do during certain exercises or certain sporting activities. With regards to the types of warming up that you can do, the more dynamic movements for warming up, where you're constantly moving, those are actually shown to be more effective than the more static or passive types of warm-ups, such as simply holding a stretch and staying still while stretching, or putting a heating pad or an ice pack on something. All those less active forms of warm-up, while not harmful, are also maybe not as effective as the dynamic ones. In terms of cooling down, it's actually important because it's the very beginning of the recovery phase after doing exercise and sporting activity. And in a similar way, dynamic cool downs tend to be better than the more passive ones. So that's where the whole concept of warm up and cool down is important. But you want to have nice, easy transitions for your body to go from baseline resting to getting into more strenuous activity.
And I know I was mentioning that a physical therapist once told me that it's important to hold your stretch for at least 30 seconds. Would you agree to that? Or how long should you hold a stretch? Or, how long should you do the warm up and the cool down, I guess, after a workout?
Yeah, I think that time frame is reasonable. Even up to about 45 seconds is, some sources will say that that's kind of the sweet spot for achieving what you're trying to do with the stretch. If you hold a stretch for maybe only 5 seconds, you're probably not doing that much. So, you want to give it enough time to allow those muscles to loosen up.
Okay. How often should I exercise or play sports? I'm sure that's a question that we all have, whether you have goals to lose weight, whether it's just to maintain your weight or just be active in general.
Especially because, sports and exercise tends to make people happy. I don't want to put a limit on that. So I prefer to think of almost the opposite question in terms of how much rest should you give yourself between doing certain types of exercise or playing sports, because that's probably the more important thing in terms of causing overuse injuries. So when you exert yourself after a certain amount of exertion, there's a microscopic damage that occurs in the muscles. The muscles deplete their energy stores, and there's some breakdown of the muscle tissue. But that's not a problem. That's all part of the process of exercise, and how the healing process that happens afterwards will make the muscles stronger and more efficient in the future. But you don't want to interrupt that healing process by repeating the activity too soon. And so that's where recovery is very important. So if you don't allow that healing process to finish, then you're starting at a deficit already. And then little by little, it can get out of hand to where there's inflammation that doesn't settle down on its own, and then you may need to take a longer break in order to let it heal properly. The amount of time needed for rest probably correlates with how strenuous the original activity was. So very light activity probably doesn't need that much of
Right.
a recovery period. Probably the following 24 hours should be enough. But then anything more moderate to strenuous, it can take from 24 to 72 hours for enough of that recovery period to take place to allow the muscles and to regenerate their energy sources and to repair that micro damage that makes them more efficient.
So that's very important, especially for someone who hasn't worked out in a long time, and then they want to take on and they join a gym like a CrossFit or something that it's a lot heavy workout. So that's something very important to keep in mind.
Exactly.
You want to go full throttle, and then you realize that you're just damaging and creating more
Yeah.
harm to your body at times.
Yeah, and it can be discouraging when your body's not well conditioned. The tendency is that you'll get even more sore than normal when you're doing a new exercise routine. And sometimes the discomfort and the duration of that discomfort can discourage people from continuing, or people who fight through the pain even after the first 1 or 2 workouts. They might be ripe for an overuse injury, and then the injury can discourage them. So being patient with new workout regimens or new sports is definitely important, to just let your body get acclimated so that you don't sustain an injury.
So I guess this question will vary depending on the level that you have, but are there some exercises that we should avoid?
I mean, I wouldn't put a black box warning on any particular exercise, because most exercises have some purpose. I think it just goes back to listening to your body, because certain exercises are fine for people who are in very good shape and don't have any kind of chronic wear and tear on their bodies, whereas, for example, people who have a certain amount of arthritis in their knees might not tolerate going to the gym and squatting heavy weight with a barbell. It all comes back to just listening to your body, and your body will kind of let you know what forms of exercise are tolerated and which ones maybe aren't so much anymore.
That's important to know. I know we tend to just push and think that, we can do it. We have a goal to lose all this weight quickly, and then, you have to go to the gym 6 times a week, and next thing you know, you're just overextending yourself and hurting your body. So I guess this goes along with some of the topics that we have. How can we build our strength safely and avoid injuries?
I think a common theme with a lot of stuff medically is all about balance. And so in terms of types of exercises to balance things, you kind of want to do cardiovascular exercise, do strength exercise, and then also flexibility. And sometimes people get really into one of those 3 facets of fitness, and then 1 or 2 of the other ones get neglected. And when things are out of balance, that's when things are more likely to go wrong down the road. And by building in a balance in your routine, that also automatically or makes it so much easier to allow proper recovery, because for example, if you're focusing on flexibility, you're not overloading the muscles that you may have done strength training with the day before, and you're giving them the time period that they need to rebuild and recover.
Oh, that's great to know. So what is the best form of endurance training to avoid injuries?
I wouldn't say that there's a best one. There's so many forms of endurance training, and some people really like endurance training, and some people it's their least favorite. My advice is to just pick one that works really well for you. These are all things that aren't really designed to um, exert peak muscle performance with just a few repetitions. It's something that's more sustained, and it could be running, cycling, swimming, even walking long distances can provide that kind of exercise to some extent. But it's about getting your heart rate up to a safe level for your age. There's all sorts of equations that you can look up that kind of give you advice on what kind of range is the target for your age. And nowadays, a lot of people have wearable technology that can, give you that instant feedback so that you know where if you're in the safe range for doing that cardiovascular exercise.
I guess the importance is just get your body moving. Don't start too fast. Just a walk is good to start off, especially you haven't worked out in a long time or done any outdoors activities.
Right. Yeah. It's not a good idea to leave the couch and go straight into a marathon. So
that's a good reminder. And, I guess this is one of the questions that we always wonder, when you start a new exercise routine, should I get a trainer? Should I find someone that can give me the proper guidance to start a workout and avoid injuries?
That's a good question. Trainers might not be for everyone, especially people who are, they've been very active for a lot of their lives and they feel pretty comfortable with, learning new exercise techniques. It might not be as useful for them. Trainers might be helpful for people who are returning from an injury or maybe have been injury prone in the past. One thing to be aware of with trainers is that there's a lot of certifications out there. And so there's a lot of variability in the expertise from one trainer to the next, or just the focus of their practice. And so if you want to work with a trainer, definitely make sure that the person you might be working with is a good fit for you based on their prior experience and just if they mesh well personality wise.
Yeah, and I guess, what I've worked with trainers in the past is just making sure that you're also learning proper form, because I do see that a lot with trainers in the past that they might put you in a workout routine, but they may not necessarily teach you proper form.
Exactly. Proper form is key with most forms of exercise and sports, because that's a great way to cause injuries, both acute and more chronic wear and tear injuries. And sometimes when someone does get injured and we sort of have to, dial everything back, initiate a rest period, and then slowly progress them back into activity, a lot of times they go into physical therapy. And during that physical therapy and rehabilitation is when a lot of focus can be placed on looking at mechanics. And that's a great opportunity for the athlete to figure out if they were using suboptimal mechanics in the first place. So that's one way that sometimes athletes come back from an injury maybe a little bit better than they were before, because now they're just doing things a little bit more efficiently.
And this is something that I didn't even think about in terms of avoiding injuries and looking at the proper diet and hydration, right? And making sure that you are preventing injuries. So how much should I drink during exercise to prevent dehydration or injury?
So dehydration is a very important topic in general, but even here in South Florida, it's even more so because it's warm year round, and there's a few months during the summer where it's very hot. And then with the humidity on top of that, the heat index can frequently go above 100. And it's that combination of heat and humidity that can get people into trouble, especially if they're doing exercise and sports outdoors. A lot of fluid can be lost through sweating, where not only water but electrolytes are lost. And so replenishing those lost fluids and electrolytes is extremely important to make sure you not only have good performance, but you're not causing a serious medical condition, because dehydration can progress to things like heat exhaustion, heat stroke, which can be something that would require hospitalization. A good rule of thumb is that you should replace lost fluids 1-to-1 during an activity. Now sometimes that's difficult to quantify, but probably a easy way to do that is to weigh yourself at the beginning of a workout or an activity, and then at least weigh yourself afterwards, and even better during, if you feel like you have been losing a lot. But that'll give you at least a rough number to go off of, because if you're 2 pounds lighter than when you started, there's really only one thing that left your body, that we hope that
it's a lot
caused
of the
that,
water
right?
that you're losing, the water weight while you work out, and that's where the dehydration comes in. So if you were, would it be safe to say how many glasses depending on how many pounds? Is there a way to quantify that?
Well, now you're asking me to do math, but the weight of water is known, and you can figure that out. But yeah, off the top of my head, I don't have the exact calculation. But another thing that people maybe ask in general is, how much water should I be drinking in a day? That's a little bit more of a fuzzy answer, because there isn't a consensus answer. There are more complicated equations out there that are based on age, and then there's just general rules of thumb. Probably the minimum would be about a half gallon for an adult, which is 64 ounces. I would say that's probably bare minimum, and but somewhere between a gallon and that is a reasonable range. But that's baseline. That's if you're not exercising,
right?
Just to keep the body working
Hydrated.
well. So then if you do exercise, you're probably going to need to consume in excess of that, based on whatever fluid losses occur during the exercise.
So I guess the safe bet will be to make sure you're hydrated when you're working out. Have your bottle of water. We all do that. And even if you're not working out, Miami, it's really hot. It's always good to have water near you, whether you bring your own bottle or find a way to hydrate, because we see it all the time, kids dropping out when they're working out, and then next thing you know.
And hydration is not just something to be done during working out. It's something that you have to take care of all the time.
Yes.
So it's before, during, and after. Another good rule of thumb to determine if you're well hydrated is to look at the color of your urine. So if it's a light straw color, that's a good sign that enough fluid intake has occurred. When it starts getting a little more dark in appearance, that's usually your body telling you that it's not getting diluted enough with water intake. There are sometimes certain medications, or even like a multivitamin, can temporarily change the color of the urine. So that's another thing to note.
Yeah, that does happen.
But just the average color is a good way to get a spot assessment of how well you're doing with your intake.
Body. That's another way to find evidence whether you're properly hydrated or not.
Yes.
So we have Miami hosts a lot of marathons and different types of competitions. When should I eat? Before competing or after competing, while you're preparing for a marathon? When is the best time? So
nutrition for any kind of sporting activity, it all falls back to the general principles of just have good balanced nutrition, a well-rounded diet, stay away from processed foods, junk foods, and you want to balance your macronutrients of proteins, fats, and carbohydrates. With respect to the longer distances, marathons, but even shorter ones like a 5K or half marathon.
Mhm.
Some people look to dig deeper into seeing if their performance or at least endurance can be improved a little bit with what they consume. I'm sure a lot of people have heard of the concept of carbohydrate loading, and that's something that's it's been shown to have small improvements in performance of maybe 2 to 3% when done properly. Those benefits are typically seen with activities that exceed more than 90 minutes. So, a shorter distance race or like a sport where there's a lot of like start and stop of the movements, it doesn't really apply. But for long distance running, it can. You want to consume more carbohydrates without doing a lot of activity to burn them off, so that your body stores them up in those temporary stores. And this can be done in the week prior. So, anywhere from like 3-6 days is reasonable. You don't really want to start carbohydrate loading too early, because if you exceed your body's capacity to store that reserve fuel, then it will convert it to fat. And that's something that can be readily converted back to energy during a marathon. So it'll just be
It
useless
will
weight.
work against you.
Mhm.
And I know sometimes, like when I used to train, my trainer would tell me have something, whether it's a protein shake or something right after your workout.
Mhm.
Is that something you also recommend?
Probably the best thing is to just make sure you're paying attention to your hydration as well as replenishment of electrolytes if necessary. If you didn't sweat a lot, then the amount of electrolytes that you lost might be more negligible, at least to replenish it at that moment, and you can get them back through your diet. But I'm sure most people who have gone to like high school sports and soccer games and things like that, you always see things like oranges and bananas on the sidelines. Those are very good, easy sources to replenish those lost electrolytes like potassium and sodium. And then but outside of that, you can get it back through your normal diet, which should be the main source of those electrolytes.
And going back to, this is something that I asked you before we started the program, the webinar. We were talking about energy drinks. Is that something that we should be having while we do activities or workout?
So that's an interesting question, and maybe I wouldn't say that that people should take energy drinks, but the caffeine component actually is shown to improve performance when consumed right before an activity or an exercise session. So for people looking to improve performance just a little bit, it is something that is fine when used in moderation. The general thinking is that one serving of an energy drink is safe when taken right before those types of activities. Now, another thing to consider is that caffeine is a mild diuretic, and so the consumption of that can also increase your fluid losses during the activity in that short term, depending on how sensitive your body is to caffeine. And so a little bit of extra attention would need to be paid towards maintaining good hydration during the activity. And you're not hydrating with energy drinks, you're hydrating with other forms of drinks like water, which is probably the best way to hydrate. But then, there are electrolyte infused waters, or Pedialyte is another good source of hydration, and even sports drinks, like Gatorade or Powerade.
But you have to look at the sugar consumption in a lot of those, because they're also not great for you.
Right, they're probably not as useful when consumed outside of activity. But if you need a quick replenishment of energy sources, that sugar actually is helpful. And so that's probably why you see it on sidelines of sports, because they're constantly expending tremendous amounts of energy, and they need to quickly replenish it. And that sugar will get used rather quickly to help that process take place.
Well, that's good to know. I didn't know that. So, what are some of the foods, or even, going back to drinks or hydration, what
Mhm.
can we do to prevent cramping while we're working out? Because that happens a lot.
Yeah, so muscle cramps are they're kind of a side effect, of when your body is dehydrated or you're starting to get an imbalance of your electrolytes. And so if you start to feel a cramp, probably the first thing you should think is, have I been drinking water? And if so, then maybe you need to start replenishing the electrolytes by using a water or a beverage that's infused with electrolytes, or getting that banana or getting that orange wedge. Outside of actual participation in sports, like at the dinner table, there's a lot of foods that are rich in these electrolytes that can, kind of build up your body's stores of them, so that you're less prone to getting the cramps later on. And these are things like avocados, sweet potatoes, milk is also a good source. Leafy green vegetables, legumes. So a lot of the good foods that we should be eating anyway are the things that help with mitigating cramps from showing up when you don't want them to.
So, what are some of your advice? What nutrition do we need as athletes to be doing sports? Some of the recommendations you may have in terms of proper diet and nutrition.
So we touched on it a little bit earlier, but it's all about balance. And I think I had mentioned the three main macronutrients of protein, fat, and carbohydrates. And then, we also recently talked about electrolytes a lot. That's another important component of the overall nutrition. Minerals, and fiber is another one that maybe gets forgotten. So all of these things coming from good sources, fresh foods, fruits, vegetables, and then staying away from processed foods, things with added sugars, making sure you get a good balance of all those things, and avoiding the bad things is probably the best bet. Now, for higher performance athletes, where they're really counting everything they put in their body to try to maximize performance, it can get a little bit more sophisticated than that. But for the majority of us, just sticking to those good principles will go a long way.
So I wanted to move the conversation to injury recovery, because it will happen. We've all gotten an injury while playing a sport, working out, etc. So I guess we wanted to know, how long should I rest, or should someone rest after suffering a sprain?
So there's no specific answer. There's no one number that you can quote for every sprain, just because sprains come in all shapes and sizes. And so it just goes back to listening to your body. In general, sprains can linger for a while because ligaments don't have a robust blood supply like muscle or bone does. And so the healing process can take a while. Lower grade sprains don't have as much tissue that need repair. And so that's something that maybe will cause symptoms for a few days, whereas high grade sprains can linger for months, and or maybe won't resolve on their own and might need more of a surgical treatment. But when a sprain first occurs, probably the best advice is to go back to the principles of rice. And most people have heard of that at some point, but just to reiterate, that's rest, ice, compression, and elevation. So rest is important because if you don't stop activity, you might actually cause further injury, or you might progress the sprain or hurt something else. the ice compression and elevation are all designed to help the inflammatory process that's happening at the site of the injury. Now, you don't want to completely eliminate inflammation because that's
Mhm.
part of your natural immune response to an injury.
Mhm.
But you know, people can get quite uncomfortable from that inflammation. For example, an ankle sprain, it can swell up so much that you can't
Yeah.
even get your shoe on. So, you know, by just managing that inflammation a little bit with the ice compression and elevation can
Mhm.
get things a little bit more comfortable. Also, you know, in certain cases, oral anti-inflammatory medications like ibuprofen can be utilized,
Mhm.
but that's something that maybe each individual should check with their doctor with just to make sure it's a safe thing to do.
Mhm.
Um, and then after that initial period of rest, you want to get back into normal daily activities as soon as you can. And so going back to the example of an ankle sprain, you know, maybe after a day of rest, you can walk on it with some discomfort. You know, and if you can tolerate walking on it, then do so,
Mhm.
but maybe not go out and run or, you know,
Right.
play basketball or whatnot. And then, you know, little by little, just listen to your body. And if it doesn't seem to be responding, then maybe it's time to get a professional opinion to see if, you know, maybe you need to do some physical therapy
Right.
do some additional workup to see if it's more than just a sprain.
So I know you touched a little bit on ice compression,
Hmm.
but what about hot compression in terms of muscle injuries?
Hmm.
Are there some muscle injuries that would benefit more if you put hot press or a heating pad
Hmm.
as opposed to icing it?
So yeah, I think this is a very important question to ask
Yeah.
because I see a lot of patients where they're not sure how to utilize heat and ice.
Hmm.
They've just heard that both are good. And what I tend to see is that someone gets injured and they'll do them back and forth in that acute period. Now, when you think about it, they're opposites. And they essentially have the opposite effect on the body. So the effect of heat is to dilate blood vessels and to increase blood flow. And then the effect of the ice is to decrease blood flow.
Okay.
Um, and so the reason why ice is like a natural anti-inflammatory is that when there's more blood flow to an injury, that blood can sort of pool in the area of the injury and cause that swelling. So by kind of restricting the blood flow a little bit, you'll curb the amount of swelling that happens. So if you have an acute injury and you put heat on it right away,
Mhm.
you're actually helping that swelling process. So for most acute injuries, heat is probably not a good idea. Whereas ice is better for the initial treatment of an injury, you know, especially that swelling that happens over the first few days. Um, Going a little further past that acute phase, once the swelling is kind of uh, stabilized
Mhm.
and it's no longer causing significant discomfort, then you can start to look towards what benefits the heat brings,
Mhm.
because uh, blood is needed to heal just about anything in the body, because that's the highway that brings all of the building blocks and the nutrients that the body needs to repair tissue. And so to help the healing response, by placing heat on injured areas, then you can you know, help the body with that. Also, heat will relax sore muscles,
Mhm.
and so for you know, things like tight, achy muscles or lower back pain,
Mhm.
heat tends to be a very good tool.
Okay, that's good to know. I'm glad you clarified that because I think we all tend to think that we just put a heating pad and it takes care of itself, but icing is the best way to heal like a sprain or something that has inflammation.
Well, it doesn't heal the sprain, but it just
Mm.
helps to
Brings
reduce
down.
that initial swelling to get you a
Mhm.
little bit more comfortable as you're sort of figuring out, you know, how big or small of an injury it is.
So in terms of concussions, because I
Mhm.
know those happen a lot with a lot of contact sports, how do we know if we've gotten a concussion?
This is another important question. And also, just as an aside, concussions can happen outside of contact sports. Someone can fall off of their bike with or without a helmet, and that can result in a concussion. Or you could be playing a racket sport, like say doubles tennis, and your partner overswings and hits you in the head with a racket, or any number of things can result in the head trauma that causes
something
a
as
concussion.
tripping and falling in your house.
Yes.
I mean, we've seen celebrities die, and then you find out that earlier that day they hit their head, and then they passed away while they were sleeping. So,
but in terms of the symptoms that people might notice, I mean, ideally, if a concussion happens, there's people around, especially people that maybe are trained in recognizing these things. That's the most ideal situation, such as the sideline of a football game or other sporting event. But if we're at the gym or our home gym or just a recreational sporting event, that resource probably isn't there. And then we take it upon ourselves to maybe recognize it. Usually people just feel like something is off. They don't feel like themselves. They can have headache. They can have like a cloudiness in their head, maybe confusion, sometimes sensitivity to loud sounds or lights, or a buzzing in their ear. Also, there might be just a complete amnesia of the incident that resulted in the concussion. But sometimes it's hard to self-diagnose until a little bit later. But probably the number one bit of advice, if there's any question about a concussion, stop any physical activity, because going back in there, toughing it out is the wrong answer, and it can actually lead to even worse damage to the brain that might not be able to repair itself. In the period after a concussion, you want not just physical rest, but mental rest. And most protocols will say that you probably shouldn't return to any sort of strenuous activity for a week. And certainly not until you're symptom free. Most symptoms will self-resolve within 7 to 14 days. But if they don't, it's definitely a time to get a professional opinion on that.
And that was going to be my question. When should you go to the emergency room after a concussion? I mean, I know you mentioned some of the keys, right? Like the clues that you may get, whether you're feeling off and headaches. But when do you think it should be important to go to the ER?
Well, with any kind of head injury, whether it's a concussion or even a broken blood vessel in the brain, there's certain symptoms that are strong warning symptoms where something is very wrong, and you want to at least rule it out before going home and resting. An intense headache, usually somebody would describe a headache as being like the worst headache they could ever imagine. That's a very bad warning sign. In a lot of cases, any loss of consciousness maybe should be looked at professionally. Also, unexplainable nausea and vomiting, or significant confusion or altered mental status, or waxing and waning consciousness. These are all signs that there may be something very serious going on, and you want immediate medical attention to at least rule it out. But if there is something that you get addressed sooner than later.
My husband says, I don't know if it's true, that you can get a metal taste as well if you suffer a concussion. Is that true, or is that something that just people talk about, or they think?
It is possible, because any kind of injury to the brain and the nervous system can make the nerves behave unusually. And so there's nerves inside of our head that control smell and taste. And so having sudden changes that that you can't explain by anything else can actually be a sign of something going on inside the brain.
Well, that's interesting. I thought he was just making it up. So how soon should someone go back to working out after being sick for a while?
Well, it sort of depends on what type of sickness we're talking about. If we're talking about like a common cold or any kind of mild viral type illness, you don't actually necessarily need to stop exercising. If you're feeling up to it, you can actually do mild to moderate exercise. There's certain symptoms where if you have them, you probably shouldn't exercise. So if you have fevers, that's probably your body's way of telling you to keep resting. Also, other gastrointestinal side effects like nausea, vomiting, diarrhea. Most people probably won't feel like exercising if they have that, but definitely don't fight through that. Especially because vomiting and diarrhea will result in fluid losses, and so you're probably dehydrated if that's an ongoing issue. And then another thing to consider is when people are sick, sometimes they lose their appetite, and so if you have a poor appetite and your intake is not good, then you probably don't have the energy stores or proper hydration to exercise safely. So if you're not that sick and you don't have those symptoms I just mentioned, and you're still eating and drinking well, then it should be okay. But overall, just listen to your body.
That's good to know. Always, and I think it goes back to that message. Listen to your body is very important. So in terms of swelling in your joint, what does that mean when you have swelling in your joint?
So there's a few things that can cause swelling in a joint. Probably the two most common break down into two time frames of the actual injury. So there's acute swelling, where it's usually the response of some sort of damage to tissue inside of that joint will start an inflammatory response by your body, and then you'll get swelling that happens almost immediately after the injury. And so immediate swelling, like say you twist your knee and then the knee blows up like a balloon, that's usually a sign that a tissue inside of the knee has become injured. Whereas more delayed onset swelling is usually the sign of a more chronic inflammation or a chronic wear and tear or degenerative process, like say someone who has a little bit of arthritis in their knee and they still like to go out and run distances. Sometimes that repetitive impact can just stir up a little bit of an inflammatory response because of the arthritis, and that can present as a more delayed onset of swelling. So whenever I see patients in my office and they have had swelling of whatever area is affected, it's always important to sort out when did the swelling occur, because it helps me to sort out if this is more of an acute injury or more of a maybe an overuse injury or a chronic degenerative condition.
That's good to know. Which was, speaking of overuse injuries, what can we do to prevent them?
So just as the name given to them,
the name
avoid overuse and you'll be fine. But all jokes aside, we've kind of touched on these things at different points of this talk, and proper rest and recovery is a very important part.
Right.
And that's another good part, another good concept to employ. The hydration and nutrition and giving your body all the tools that it needs to rebuild muscle and tendon tissue after that micro damage that you're doing on purpose to make yourself stronger and more conditioned. So just following all those principles, listening to your body, don't work through pain, and that can prevent a lot of overuse injuries.
And speaking of sports injuries, because this is your world, what are some of the common injuries that you see in your office?
So there's certain body parts have certain types of activities that are very associated with those injuries. And that doesn't mean that you're only going to have this type of injury if you do this type of sport or vice versa, but things kind of happen in patterns. And so kind of working from the top down, throwing athletes such as baseball pitchers, quarterbacks, they do a lot of repetitive high intensity movements with their dominant arms, especially the shoulders. And so they tend to get injuries, in their shoulders, such as rotator cuff injuries or labrum injuries. Also people who do jobs where there's a lot of repetitive lifting, construction workers get a lot of more chronic degenerative injuries with their shoulders. Moving down a little bit further to the elbow, a lot of the racket and club sports like tennis and golf, they can get overuse injuries at the elbow, not just on the inside of the elbow, but the outside, even though the common name for one is tennis elbow and the other is golfer's elbow. They can get both of them, and people who don't play either sport can get them as well. But just because of the way that those movements are performed, they're putting a lot of stress on those static structures of the elbow. Going further down, in terms of like the hips, you can see a lot of hip injuries in more contact sports such as football. People getting tackled, taking a helmet to the upper thigh or the hip area, they can get contusions, or other types of muscular injuries in that area. A lot of sports injuries happen around the knees because so many dynamic movements are kind of going through the knees, and there's a lot of pivoting and rapid changes of direction that happen there. And so soccer, American football are some of the more common places where we see ACL injuries, just because of those sports in particular require some very quick bursts of speed and then sudden stopping and then pivoting and changing direction. And that's you can create a moment where you're putting a lot of stress on that one ligament and not much else. Other sports that can affect the knees are things like running. So a lot of runners can get tendonitis, where they get aches and pains around the knees, and they can get it in the front of the knee where the patella tendon is, a little bit off to the side where there's a collection of 3 tendons inserting just below the knee. IT band syndrome is another common thing that runners Google plenty when they're getting aches and pains down the side of their thigh and heading towards the knee. So they tend to get a lot of these more chronic lingering aches and pains around the knee. And then to wrap up, working all the way down to the ankle area, a lot of the sports where there's a lot of jumping and landing, such as volleyball, basketball, they can get a lot of ankle injuries, mostly sprains and things like that.
So we've learned a lot. We covered so much. I think some of the big takeaways for sure is listen to your body.
Yes.
Hydration is very important. Moderation is the key. Start slowly, but get your body moving. Would you agree? Or
that was an excellent summary.
Because it's important, it's like the opposite of not working out or not moving your body. It's also can create pain as well. So I want to thank you so much for spending the time talking to us. Dr. Inzunza, you have shared so much knowledge and information. We really appreciate your time.
My pleasure. I love talking about this stuff.
Thank you. And thank you to you for joining our webinar. This is Conversations in Care, a program that was created by the Jackson Health Foundation. If you would like to get more information and be more involved with our foundation, you can visit our website at jacksonhealthfoundation.org so you can learn more about how you can help or make a donation. Have a great day.
Bye-bye.